Hello, I'm Rob Wilson and I'm the Chief Executive of the Conservative Drug Policy Reform Group. We're a fairly new organisation in that we only really launched late in June, and really we've come from the centre-right of politics, in the sense that much of the debate about drugs and drug reform and about cannabis and medical cannabis has been on the left of politics for a long time now. And it's something that the Conservative Party and other centre-right organisations haven't really engaged in properly, and have really ignored some of the arguments that are being made. And we come from the point of view that some of the beliefs that have been ingrained for a long time within the centre-right about drug reform are wrong, in the sense that prohibition actually isn't working, and actually it's causing a huge amount of damage to families and communities up and down this country. And we very much believe that we can't continue with a policy that isn't working. And in the same way that the left closed down the issue of immigration for more than a decade, there's a danger that the centre-right is closing down the argument and debate on reform of drug policy. So we're really here to try and encourage debate, encourage engagement, and encourage new solutions to come forward to some of the challenges that we face right the way across the country. There are a record number of people dying from taking drugs in Scotland, higher than the rest of the UK and higher than even the USA in terms of deaths. So this is a really serious problem that needs to be fully engaged in. We're taking a really fresh look at everything to do with drugs and drug reform. We're an organisation that really is fundamentally there to look at the evidence and provide the evidence for the engagement around the debate. So there are three essential bits to what we do. The first one is around medical cannabis. Now, that has been legalised since last year, thanks to the Home Office changing the rules under pressure from some cases of young children like Alfie Dingley, and there were others as well. And so the Home Office changed the law, but actually very few people are receiving medical cannabis, and there is clearly an enormous number of people who can benefit from a properly regulated, safe system. So we believe that early safe access to medical cannabis would be a thoroughly good thing. Our second area of work is looking at the whole area of cannabis more broadly, and looking around the world at what's happening in Canada, in some of the states in the USA, and other parts of the world, Uruguay for example, where recreational cannabis has been legalised. Now, we are not advocating the legalisation of cannabis. We're not advocating the decriminalisation or even regulation of cannabis. What we are doing is we are using our ability and our research potential to go out and look in detail at those markets and see if any of it will be beneficial to the UK in terms of formulating its own policies. And the third element we're looking at is also wider drug policy, because there's lots of experience now, having had 70 years of prohibition around the world. There are changes taking place. In fact, changes are sweeping forward at quite a considerable rate now. We need to look at those and see if any of those can reduce harms that are currently taking place in the UK. And we think that by gathering that evidence, feeding it in, we should then move to something like a parliamentary inquiry or a royal commission. But we want some kind of independent inquiry that looks at all the evidence and can make a judgment on what the best way forward for the UK will be in the future. So with regard to medical cannabis, clearly there's a big problem. The Home Office has legalised it, but in fact very few people are able to access it for a whole host of reasons. Not least that many doctors won't prescribe it, because obviously if it's not on the list of medicines they are advised to prescribe, there are all sorts of insurance worries that they have. So the regulations and the support the doctors get is not quite there yet to make it easy to prescribe. So what we're trying to do as an organisation is we're trying to help those people in authority to design the right system based on the evidence. So we have a phenomenal set of advisors on our Policy Advisory Council who know this area inside out and know all the pitfalls in delivering medical cannabis to patients. And what we're doing is we are gathering the evidence to help devise a system that will actually work. We're looking at Germany, for example, where now hundreds of thousands of patients are getting legal prescriptions as and when they need them through their national insurance system, which has been set up by the German government, for example. So we are looking at those systems to see if they are usable and whether the regulations are usable in the UK. But there are other examples. Jamaica did this many, many years ago, and they have a proper regulatory organisation that is dealing with all these issues. So there are places in the world where you can look and you can actually see how best to implement these policies if you want doctors to actually prescribe medical cannabis. Now, that's not to say that medical cannabis is a silver bullet. Far from it. We have to understand that there are limitations to it as well. There are some conditions where it is clear, and indeed the Chief Medical Officer has confirmed this, where it does make a big difference to patients. And those are, for example, children with epilepsy, pain relief and MS. So areas like that, for example. So what underpins what we're trying to do is we're trying to reduce the harms to society that illegal drugs are delivering at the moment. One only has to look at the fact that thousands of people are dying every year because of the way the drugs are used and what's in the drugs. I mean, we did a survey with YouGov very recently, and we found that there are thousands of young people who are simply taking drugs. They have no clue what is in them. And obviously that every time they take a drug, there's a huge risk to their safety if they don't know what's in the drug. And so we want to protect those young people. We also want to make sure that people that want to live healthy lives can go to seek health support if they're on drugs of some sort and they want to come off. One of the deterrents to seeking out help is often that they are illegal drugs, and they are worried that if they go to the health services they may have some negative comeback, the police might get involved and so on. And that then leads to the criminalisation of a whole generation of young people. And clearly, if you're a young person and you get convicted of a drug offence, even however minor it might appear in the catalogue of the many violent offences and others that are out there, it still affects that young person's life. It affects whether they can get a job, how people perceive them, and it becomes a real stigma and something in their life that they can't easily remove. So these are all things that do harm young people, and we as an organisation want to see how we can stop that harm continuing into the future. And that's not going to be a particularly easy task, because we have to move the whole thinking about drug reform to be able to achieve that. One of the big issues we face with drug policy is that by making it illegal, it hands the control, the distribution and the financial incentives all to criminal gangs, and most of the drug industry now is run by criminal gangs. And the problem is they've become more and more violent. They've moved over the years from beating people up to using knives, and now guns are prevalent in the whole industry, protecting their turf. And one of the reasons why we are getting such violent behaviour around London is clearly to do with gangs and territories being marked out and drugs being involved as well. And what drug gangs are now doing, and have been doing for a few years, is they've been using children effectively, very young people, to act as their sort of drug mules, taking those drugs across county lines to deliver drugs into areas normally outside their control, to try and bring them into their orbit of influence. And young people are seeing and doing things that no child should have to face as a very young person. And again, one of the things that we need to do is make sure people understand this, and make sure that the police are able to tell the real stories behind what is going on. And you can see from the police forces around the country, they're beginning to take different approaches to deal with some of the drug problems that they face, because they understand that the policies they've been trying for years and years and years simply aren't working. So now they're beginning to innovate and try and do things differently, and that is only a good thing, particularly with this county lines thing and these young children who are being exposed to all these potential harms. So one of the challenges faced by our police forces around the country is the difference between policy, government policy, and practical reality on the ground. Police forces are finding that the prohibition that is the policy at national level just isn't working at ground level, and it has become impossible to contain the illegal drugs gangs. I mean, they'll shut down one group one day and it'll be open, operating probably more effectively in another location the following day. So they're having very, very little impact on drugs, and of course communities, families are being affected very negatively while these drugs are being sold on our streets in the way that they have, because nobody knows what's in them, and the violence that's associated with moving those drugs around is becoming an epidemic in some parts of the country. We are, as the CDPRG, have a programme of activities that we're going to be doing over the next year. We have a series of research papers that we're working on. We are going to be holding a number of seminars. We're working with a range of different organisations to put evidence-based papers together. We are going to be involved in the media, getting out there, telling people what the actual evidence is rather than what we think should be happening. It's got to be, in this space for the centre-right, all about the evidence going forward, so that we can deliver reforms that actually do good rather than create more harm, which has got to be the centre of any debate that we have on this subject. So if you're on the centre-right of politics and you are interested in drug reform, we need you to get involved in what we're doing. We need more people to understand what the evidence is on the centre-right of politics, because only when people understand the full evidence can we start getting to the right solutions. And that means evidence from around the UK, it means evidence from countries across the world, and then it needs as many people as possible to persuade our politicians that change can take place for the better, that policy reform in this area can be a very positive thing for families, communities and the country as a whole. And so we'd like as many people and organisations on the centre-right to get involved with what we're doing. We are prepared to work across political lines, we're prepared to work with all organisations, and we're also interested in evidence from wherever it comes from if you want to provide it. We also want to share your stories about any engagement you've had with drugs, whether it's medical cannabis, recreational cannabis or other drugs. We'd like to know your stories about how it's affected you, for good or for bad, depending on what kind of drug it was. We'd like to know how it's affected your community, your family. We want to tell all the stories that are out there. So again, we're bringing on the ground evidence of what's really happening out there to the attention of policymakers and politicians. So if you want to get in touch about any issue, please get in touch with us through our website, which you can go and see at www.cdprg.co.uk.